In this powerful and deeply grounded conversation, my guest reflects on how grief, authenticity, and courage have shaped her leadership and life. From running for APHA President while mourning the loss of her father, to resisting pressure to censor public health language, she shares what it means to lead with heart and to keep showing up even in the hard moments. She invites us into her world as a mother, sister, and advocate, someone who takes up space with joy and integrity while modeling what it looks like to center both community and self. With clarity and conviction, she reminds us that courage isn't always loud. Sometimes it's choosing joy, protecting your peace, and standing firm in your truth. You're listening to the Courageous Public Health Podcast, Episode 17. To all the courageous Black, Indigenous, and women of color leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I'm an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have unfiltered conversations with BIPOC women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then let's dive into this brand new episode. Thank you for joining me on this episode. I'd like to start by introducing myself if you're brand new to the podcast, or reintroducing myself if you're a returning listener. My name is Dr. Christy McClamrock, and I am the CEO of the Courageous Public Health Consulting Firm, where we support public health organizations through workshop design and facilitation and speaking engagements. I am so excited to introduce you to my guest on this episode. Let me formally introduce her, and then we'll jump right into our conversation. Dr. Nandi A. Marshall is a community-engaged scholar committed to maternal and child health equity and preparing the next generation of the public health workforce. She is a professor in the Department of Health Policy and Community Health and the Associate Dean for Academic Affairs at the Jianping Su College of Public Health at Georgia Southern University. Dr. Marshall holds a BA from Spelman College, an MPH from East Stroudsburg University, and a DRPH from Georgia Southern University. Dr. Marshall is also a certified health education specialist, a certified lactation counselor, and a certified diversity executive. Dr. Marshall has over 22 years of community engagement experience at the local, state, and national levels, particularly around health inequities. These experiences, along with her completion of the Health Equity Leadership Institute, the Birth and Breastfeeding Leadership Institute, and the Georgia Governor's Teaching Fellows Program, have fueled her commitment to addressing the social determinants of health through community engagement, breastfeeding equity, and preparing students to address public health challenges through a health equity lens. Dr. Marshall is compassionate, creative, and solution-driven, with experience that has transformed her leadership in the public health and first foods field. She is president-elect for the American Public Health Association, where she has also served as the chair of the Science Board and co-chair for the Joint Policy Committee. Dr. Marshall has also served as the education and training co-lead for the Georgia Society for Public Health Education and is a co-chair of the Student and New Professional Caucus for the Society of Public Health Education, where she currently serves on the membership committee. She also serves as a member of the CRASH Committee for the United States Breastfeeding Committee, which focuses on equity issues in breastfeeding, the USBC Nominations Committee, and previously as an APHA member representative for USBC. She's also a board member of the Georgia Breastfeeding Coalition. Dr. Marshall is also a member of the Bullock County Board of Health, the Mayor's Commission on Diversity and Inclusion, one borough, in Statesboro, Georgia, the Racial Equity and Leadership, or REAL, Savannah Task Force, and the Savannah Ghana Alliance. As a community engaged scholar, Dr. Marshall has been involved in securing grants as a PI, co-PI, and contributor in community-based programming and participatory research, including a Centers for Disease Control and Prevention Racial and Ethnic Approaches to Community Health, or REACH grant, Savannah Hope, on which she is a contributor leading the Breastfeeding Continuity of Care Initiative, and a grant from the Georgia Department of Behavioral Health, on which she is the PI to implement evidence-based programming in a Chatham County high school to prevent opioid use. Most recently, Dr. Marshall secured $3.25 million in funding to assist disadvantaged students with financing their graduate public health degrees. Dr. Marshall has published book chapters, handbooks, and peer-reviewed manuscripts, including a 2023 release focused on amplifying the voices of Black and African American women regarding barriers to breastfeeding. She also received the 2021 Healthy Savannah Health Initiative Award based on the Photo Voice project highlighted in the aforementioned article. She is a nationally recognized and invited speaker and is committed to equity, service, and advocacy. Dr. Marshall is a proud member of Delta Sigma Theta sorority and a devoted wife and mother of 2 children. Let's connect my conversation with Dr. Nandi Marshall right now. Okay, I want to introduce Nandi Marshall. Nandi, I'm so happy that you're here. This is exciting.
I'm super excited to be here. So thank you for inviting me.
Absolutely. I'd mentioned to you before we hit record that you're the first person to be recommended by 2 independent people. So
very heartwarming.
Yes. So you get that honor goes to you. I'm going to get you a little plaque that's like first person.
And I will proudly put my plaque in my office.
Yeah. I mean, you have a lot of great plaques. I know. I'm very excited to interview you today. I'm going to start by letting you introduce yourself.
Sure. So I'm Dr. Nandi Marshall. I'm the Associate Dean for Academic Affairs in the Jin Ping Su College of Public Health at Georgia Southern University. Always a mouthful. I'm also President-elect for the American Public Health Association. Super excited about that. I'm a wife, mom of 2, lover of Disney, Marvel, collect Funko Pops. There you go. Oh,
yes.
I also collect Minnie Mouse ears, and I can't forget to say that because it's one of my tried true treasures.
Okay, that's a fantastic introduction.
Look, you see Minnie Mouse right there.
Yes, absolutely. Oh, that's great. That is great. See, we know something that we wouldn't know just from your bio.
That's not in my bio.
It's not in your bio. So, okay. I just wanted to say something too about how we met. That we met at the Women's Leadership Institute workshop last October, just before APHA. Mm-hmm. And that was an exciting time for you.
It was very exciting and busy and stressful and a happy time, but just a lot.
Oh my gosh. When you said President-elect for APHA, I was like, where's that button that I can push that makes the confetti go? And it's like, oh yeah, no, I don't think that works. I don't think that works with Riverside. I'm not on Zoom. We're not on Zoom, but just know if we had been on Zoom, there would have been confetti falling around your face.
No, absolutely. I mean, and just to give some context to the stressful piece.
Yeah.
So during that conference, I was serving as chair of our board for the association. And then I'm one of the organizers for the Women's Leadership Institute, and then had the bright idea to run for president all at the same time. So it was like I had all these meetings to get to, and then had to make sure that I wasn't neglecting our institute because like that's one of my babies. I love that program. So it was very stressful, but I ended up coming out successful on the other side. So it's all worth it. All worked out in the wash.
Yeah, I think I messaged you on LinkedIn like the day before the workshop, and just to say like, hey, I'm coming to this and I'm really excited about it. And you responded. And part of me was like, I can't believe you responded. You have so much going on.
I do. I try to be good with getting back to people, mainly because, so working at a university, right, we always tell our students, don't be afraid to reach out. They'll reach back. And so I try to stick to that on all my platforms. It gets a little challenging. I'm not going to lie. Like there are sometimes I go on LinkedIn and I'm like, oh no, this person messaged me a month ago. Um, so I'm not always the best, but I try hard because you never know the information or feedback or connection you make and how that might help somebody. So I try, but I can't say I'm 100% on it, but you just hit me at the right time.
I hit you at the right time. I definitely did. And I was very surprised and honored to get a response. So thank you. Thank you for that. All right. Well, I think we should dive into the questions. So I want to start. I like to start by reminding our listeners that bravery is taking action without fear, while courage is taking action despite fear. Mm-hmm. And I'm really interested in people's examples of courage. So I would love for you to share some experiences from your professional life, from your personal life, where you acted courageously.
Sure. I guess I'll start with my personal life.
Okay.
I think, so there's like a specific example that I can give from my personal life, and then there's more of like a philosophy, maybe, so to speak, from my personal life. So I think the first one, which is probably the easiest one to remember, was just running for president-elect. I think that was one of the scariest things I've done in my entire life. And I almost didn't run for a number of reasons. But I remember reaching out to my sister and we were talking about it. And she's like, well, why are you so hesitant? She said, if you weren't scared, would you do it? And I said, hell yeah. And she said, so then why are we having this conversation? And when she put it in perspective like that, I said, oh, okay, you're right. I shouldn't let fear run my life because it's something that I wanted to do. So I think for me, that was one. And, I will say that experience, while it was stressful, it was a lot. Even if I hadn't won, I think what I learned during that process, some of the connections I made, like it was an amazing experience. And so I'm glad that I went ahead and leaned in and went after it, even though I was scared. I think the second piece of that, where I said more of a philosophy, is I remember as I approached 40, so I'm 43 now, and I remember as I was approaching 40, my sister said, wait until you turn 40. She said, the way you see life, the way that you make decisions, it's all going to change. And I was like, no, it's not, or whatever. Like, you know what I'm saying? I kind of was just like, Well, when I tell you, when I turned 40, it was like something clicked. And I said, I have to do a better job of censoring me and what works best for me. Like, yes, there are things I need to consider. As I mentioned, I'm married, I have children, I have a full-time job, I have so many things, right? But at the same time, I can't do things for the sake of others if I'm not serving myself too, and making sure that I'm happy and making sure that my needs are met. And so I've tried really hard to make sure that I consider, is this good for me? Is this going to make sure that I'm still happy, that I'm still thriving? Which is scary because I'm so used to being a people pleaser and making sure everybody else is good before I make sure I'm good. And so I make sure that I'm reading, right? If I want to read something on my Kindle, I'm picking my phone, my Kindle, whatever. And my family jokes about it all the time. But yes, while I enjoy reading, a lot of that too is making sure that I'm good, right? So 3 years ago, the same year I turned 40, a few months after I lost my dad, that this has been like the longest 3 years of my life. It's been really hard. And so part of that was also, I need to make sure that I'm taking care of me. Grief is a beast, right? And so making sure that I'm happy too within grief has been really hard. But part of it too was, and that's courageous for me, is making sure that I can still find joy in grief, which I think has been really hard. And so part of that journey, like I've even been on Facebook where I share a lot of my grief journey because I want other people who may not feel as open to talk about their grief, that hopefully they can see some of the things and see that they're not alone. So stuff like that brings me joy, talking about it, again, reading, going to the beach, hanging out with my family, right? So the other part that's a part of that philosophy is learning how to say no. I've gotten much better at saying no after turning 40. I was horrible at it before then, right? I mean, to the point that I remember my supervisor sat me down one year during an evaluation and he said, I don't really have any feedback for you. Like, you're doing great, but you need to learn how to say no. So when you're supervisor, he's like, even if that's from me, you need to learn how to say no to me. So doing that is really hard because, again, how can I make your life better? How can I make sure you're happy? That's how I've always operated. Someone needs something, I got it, even if it's at the detriment of me. And so, like, that overall philosophy of keeping me centered and happy and in the space of joy, it's hard. Have I mastered it? Absolutely not. But I'm more intentional about it and making sure, like, checking in with myself and seeing, okay, why am I feeling like this today? Okay, that makes sense. What can we do to make me feel a little better, even if it's only for 5 minutes? So I try really hard to center myself, which again is not easy. Um, but I think for me, I would say from the personal standpoint, those are the things that have been more courageous for someone like me.
That's really great. And I just feel like we should give a shout out to your incredible sister. I mean,
Yes.
yeah, that's some great sister love right there
Yeah,
that you just talked about.
Yeah, my sister, Anasa Troutman. She is the CEO founder of Big We. She also runs Claiborne Temple, which is going through some really hard times right now. Someone set Claiborne Temple on fire. And it's been a huge tragedy. And so I just want to take a moment to just uplift Claiborne Temple and the Memphis community. They have done so much for my sister, the Memphis community, and she loves Memphis. So my sister is amazing, and I'm really happy that I'm able to share her with Memphis. She's super committed to Memphis and loves the people there. So again, I just want to take that second to just uplift Claiborne Temple in the Big We. But my sister is like legit. We talked about before we started recording, right? We talked about the superheroes. My sister is literally one of my heroes. She is somebody that I have followed, obviously, for the last 43 years. But she, man, I can't even put into words how amazing my sister is. She's one of those people that no matter what obstacles are ahead of her, like, she doesn't give up. My sister will find a way to make something happen, and that has always inspired me. So if you ever have an opportunity to hear Anasa Troutman speak or meet her, please do. She has a TEDx up on YouTube that you could look up. Like, my sister is just dope. I love her so very much, and I'm super excited that she's not only my sister, but I can truly call her a friend. So she's a really great person.
Oh, that's so lovely. Thank you so much for sharing that.
Yeah.
That's great. Okay, so I think you said you had an example from your professional life as well of courage.
Right. So the professional example, it's really about some of the things that are happening now, right? So for those of you who are familiar, we have public health education, right? So public health education is essentially the same way you have education or math education, right? So in higher institutions, we have schools and programs of public health. Some of the things that have been happening, I guess, over the last few years, though, and it's happened in states like Florida and some other states where folks are having to start to change what they call classes, descriptions in classes. You can't say certain words like health equity or underserved or minority or Black or LGBTQ or whatever, right? Still in between, everything in between. And so folks are having to navigate, well, how do we teach public health if we can't say these things, right? The whole point of public health is about making sure all communities are healthy. So if we can't talk about all communities or we can't talk about disparities, how do we still have the same impact? And so, yes, work has been done before we had these coined phrases, but obviously words are important. What we say is important. And it also helps to make sure we're all talking about the same things and working towards the same goals. And so it's made it harder for some people. And so we're at an impasse now where Georgia is potentially doing some of these things. We don't know, right? There's some things up in the air. We haven't received any particular mandates yet that we have to do this, at least as of 3 days ago. I'll say before the beginning of the fiscal year. I don't know if anything has changed since then. I haven't heard anything. But some of the pieces, there were some recommendations that we should go ahead and change classes or go ahead and change descriptions. And I said, I don't agree with that. And so I don't think that we should. And I said, I'm not doing that until we get a mandate. Do I think we should plan? Of course. There's nothing wrong with planning. Like, keep in mind, preparedness is public health, right? So whether you're preparing for a disaster or you're preparing for a change in something like education, competencies, or even just a word, having to change your description, great, let's plan for it. What are some of the things we may have to consider? But why are we making changes if we're not required to? We are public health. We're a school of public health. One of the things that is a keystone of public health is advocacy and speaking up for those who can't. we should be doing that as a college. And I'm absolutely doing that in my role and who I am. And so, I think that people have appreciated that. I know that there are some faculty and staff who felt like they didn't have the proper platform to say those things, or maybe they didn't want to because they may be worried about, whatever. Fill in the blank for yourself and read between the lines, right? But for me, I have always been someone who advocated for others. That's just my life's work, right? I work with communities. How can I support you? Again, remember what I said earlier. And so while I may be a people pleaser sometimes to detriment, sometimes it works for the greater good because I'm also trying to make people healthy through that. And how do we make communities healthier? And in this instance, my community that I'm speaking of is where I work, the people I work with, and the students that we serve. We are here training students to go and be great stewards of public health, great stewards of community engagement. And it's harder, not to say we can't do it, but it's harder to do when we can't teach them what needs to be taught. And, we had always been told that as long as it's in the curriculum, it won't be an issue. Well, now I think that might be changing. And so, again, it doesn't mean we stop doing what we do. Yes, we'll have to pivot and figure out how to do it. But it'll be so much easier if we don't have to change work. Like, we're worried about the wrong things. Like, we're worried about what we're calling something, or worried about, folks are worried about. I'm not saying we, because I don't want to change it. But there are people more concerned with what we call a class and a description than the people are dying, right? Like, why don't we focus this energy on finding solutions for maternal and child health deaths, or finding solutions for increasing breastfeeding rates, or finding solutions for getting rid of cancer, whatever, fill in the blank. Why, stop worrying about that. That's not the right thing to worry about. You know what I'm saying? Like, we have threats to all types of public health infrastructures right now. People are losing their jobs, and I'm so scared about what's going to happen over the next, not even 10 years. Like, I can confidently say with the cuts that are happening right now to our public health infrastructure, which already wasn't amazing, people are going to be dying immediately. Communities are losing funding. Programs are being cut that are needed. Like, it's really scary. Like, I remember a few weeks ago looking at an advocacy alert email from one of the public health organizations of which I received updates, and sitting at my desk crying. Like, why are we doing this? This is not the right move. And sometimes you feel like, well, no matter what we say, they're going to do it anyway. And I hear that. However, why not speak up then? Why sit back and not do everything you can to try to make? Because you never know. There might be something you say to your senator or your congressperson or your local person, wherever you're trying to advocate, or at your job. There might be something that you say that is heard differently than what somebody else says that can make a change, right? There's one thing that my dad used to say, so he was in public health too, and he had this thing about the power of one and how one person can make a difference. You might be that one person. So speak up. And if you can't, encourage someone else to speak up for whatever reason that you can't, right? But it's really about speaking up. And so for me, even though in the moment I was not worried about anything other than I need to speak up right now, this is important to me and I need to say what I need to say. And so I did.
I think it's a really good point that sometimes when people feel like they can't speak up, that's like the end of the thought. It's like, I don't feel like I can speak up. But this idea that, like, if you recognize in yourself that there's something that matters to you, and for whatever reason you can't speak up, that doesn't mean that you can't support other people who can. And I'm not sure that everyone goes there all the time, right? Like, we don't necessarily go there. But you're right. And, your dad was right.
Absolutely. And I mean, even in that, there are other things you can do to support whatever it is.
Absolutely.
You know what I'm saying? So you can send an email over here where no one else knows what you're doing, right? Send it from your personal email. Don't send it from your work emails. But if you want to send something to your senator or your congressperson or your mayor or whoever, do it. Or encourage the people that have the capacity to do it. Reach out to your NAACP, reach out to whoever, whoever's doing these sort of action pieces in your community, locally, statewide, nationwide. Show your support in that way. Send a donation, whatever. There's so many things you can do to support the beliefs that you have. You know what I'm saying? So we're not always all meant to use our voices, even though I really wish people would. And so that's something to me that I really try to get across to students, like not even about policy changes, but just about your own community. You have a voice, right? Use your voice. And I don't think everyone always feels empowered to do that. And there's so much within that. So that's something that we try to do as well, right? To encourage our students in our community, like remind them that you have a voice.
I mean, fear, which people have fear for lots of different reasons. Like fear can often stop us in our tracks.
100%.
And that's why courage is so important. It's like, don't let fear stop you in your tracks, because there's always something that you can do.
Yeah, absolutely. There is always something you can do. I think the key is to figure out how to balance what that something is and what effects it can have, right? Because people, I mean, me included, people don't necessarily have the luxury to do something that might cause them to lose their job, for instance, right? Because at the end of the day, you have mouths to feed or you have whatever. So it's really about finding the balance of what works for you, what you're able to work through. And, you know, if you're okay with that potential outcome, which many are, okay, like let's be clear about that, then do what you need to do. And if not, again, finding that balance that you can be the voice and use your voice in whatever way you can to make a positive impact for your community.
Yeah. Yep. So true. So courage isn't just about taking action despite fear, right? It's also about claiming and expressing your power, especially in spaces that may not always welcome it. So I'm very curious about how you express and embody your power as a Black African-American woman doing the work of public health. And, you know, just some of the challenges that you faced and what strategies you've used to help navigate those challenges.
So I think that's a really great question. I would say that the way that I do that is just by doing it. So I don't, like when I introduce myself, I don't say I'm a Black African-American woman. I don't say I'm a woman. I don't say I'm Black. I don't say I'm African-American. I just show up as me, Nandi. And people see what they see. They perceive what they perceive. And we take it from there. But I think that alone does enough. And it does what it needs to do for the people who need to see it, particularly those young women who look like me and have experiences similar to mine. I think so often, particularly as a faculty member in Southeast Georgia, I remember when I first started working, I was at Armstrong State Atlantic University. And I was teaching undergraduate classes, and I had some young Black women come up to me after class and say, "You are the first Black professor I've ever had. I can't tell you what this means to me." But I didn't have to go in there and say, "I'm Black, I'm a woman," right? I just did what I do. And I showed up as my full self, which is something else that I do everywhere that I go. So the happy, silly, you know, that's me. Whether I'm in a business meeting or in my personal life, I show up as me. I may tone it down some in business, right? But I always bring my whole self. And I think that speaks volumes. And I think it shows others that they can be their whole selves too, which I think is really important. Being our whole self is really key to truly being joyful and happy and being able to lean into your passions and give what you need to give to the universe. Like you have to be your full self. You have to. Like your full self is amazing. Don't let anyone else tell you that it's not. And so honestly, that's what I do is I just show up as Nandi Marshall and y'all gonna get what you get.
I love it. I love it. I so often these days find myself when I'm talking about being my full self, it's like I have to like spread my arms wide and be like, my full self, take up the space. You know, it's like I literally, it's like I embody that as wanting to stretch my arms out wide. And
absolutely. Because sometimes people may make you feel like your full self is too big.
Yeah.
And try to make you be smaller, right? No, you're gonna get these nails that I got done right before I went to a conference. And I remember my husband said, "You picked those colors right before a conference?" I said, "And I sure did, because this is what I felt in the moment. This was what was making me happy." So it was more important to me to lean into that. Again, another example of leaning. It's a nail color. It's not. It's not changing anything about my intellect. It's not changing anything about how I treat people. It's a nail color. And this was what I chose for this particular week that I went. You know what I'm saying? But this is me. I love colors sometimes. Sometimes I don't. And this week, this is what I wanted.
You should. Maybe you can describe your nails for the people who are just listening and not watching the video.
So this time I have, so my actual hands match, but each finger has a different color, right? So we'll give an example. So on the right hand, I have 5 different neon colors, but it's in a style of like a French manicure. So only the tops have colors on them, but it's the same pattern on both hands, but they're neon colors. sometimes most times when I get a French manicure, I do the traditional and just get the white. Or sometimes I just have nude colors. Sometimes I'll do a solid, but I don't get designs often unless it's like my birthday. I'm going on vacation. But this particular time, this was what I wanted. I said it's summertime. I'm literally a few weeks out from my dad's 3-year death anniversary, and I want something to make me smile. So I got the neon colors, and
I love it. I love it. I've actually, so since my my business colors, which are also like just my favorite colors in general, red, black, brown, and gold. And so I don't have this right now, but I have been getting red with black tips, like French manicure, which I've never seen before. But I'm like, oh, this is so me. Like sometimes it's just, yeah. I mean, self-expression in the form of nails is a real thing.
It really is. I don't know that people understand that. Like those of us that religiously get our nails done, like that's important.
It's really important. It's really important. Yes.
Absolutely.
Oh my gosh. Love the nails.
Thank you.
So, okay. So I love everything that you've shared about courage and power. And I want to look ahead with you. So I want to hear about your vision for the future.
Oh, goodness.
And when I say vision, I'm going to give you, a couple examples. So, it's your vision for public health, your vision for BIPOC communities, how you see Black African-American women shaping these futures. And then, of course, I want to know what your personal vision is for your future.
Oh, goodness. Okay. This isn't a tall order at all.
It's a question with multiple parts. I should give it to you like part A for public health.
A for public health. So I would say, honestly, the easiest answer and really what my answer is just for everyone to be happy and healthy, everyone to be able to live up to their potential. I think, but what that means though, like underneath all that is equity. Like, let's be clear. I'm not just saying rainbows and stars in the eyes. Like, we're literally talking about equity. We're talking about getting rid of systemic racism and racism, period. I mean, let's be clear. We're talking about eliminating health inequities. We're talking about making sure people have access to what they need to live a healthy life. It's one thing to say, I want everybody to be healthy, but how do we do that? People need to be able to have access to what they need in an equitable manner, right? People need to be able to have what they need to survive, to live, to thrive, to be happy, all the things. Like people shouldn't have to choose between rent and groceries. You know what I'm saying? And so for me, that's what my vision is. I just want everyone to be able to have the opportunity to thrive and be healthy. That is really important. How we get there and how long it takes to get there is another conversation for another day. But I think to me, that's my overall vision. I think for part B, like with BIPOC and African American women, first, let me just say, I completely hate the term BIPOC. It has always rubbed me the wrong way.
Okay, talk to me about that.
Yeah, absolutely. And so I'll say that I appreciate you by asking me and talking to me about my experience as a Black and African American woman, right? Because to me, it's important to name the communities that we're discussing, that we're engaging. You know what I'm saying?
Absolutely.
I understood why the folks who came up with this whole BIPOC thing, I get it, but I don't like it and I don't agree with it because to me, we're censoring whiteness and we're lumping everybody together, right? And so it's like all we're doing is just saying people of color without saying it because you're saying BIPOC, even though that's literally a part of the definition. But when you say, like, if you say people of color, people don't like that. But when you say BIPOC, it kind of covers it up. And it's still doing the same thing it's been doing for centuries, and that's censoring whiteness. And I'm not here for that at all, right? If we want to talk about Black and African American communities and how we work with those communities, then we do that. Or if we want to talk about how do we support Indigenous communities, then we say that, right? And I think so often people, even though I think the intention behind it is not to lose those communities, but that's exactly what we're doing. Exactly, in my opinion. And so I will say though, as the main intention of your part B of what I see for Black and African American women, is that what's the question?
Yeah. Let's say it. Let's phrase it that way.
I say be you. Like to me, that is my that's my vision for the communities for which I identify. Like, I think it's important for you to lean into who you are. Be you, regardless of what other people think about you. Look, I have locks. Wear your locks. Wear your nose piercings. Wear the color nails you want. That does not take away from who you are, how intelligent you are. And I hate that people pass judgment on those things at all. Like, I hate that. But I think that's another way that I personally have shown up for myself and even been courageous without me even recognizing it, is that I wear my locks. I don't care if you like them or not. I have my nose pierced. Like, those things at one point in my life, I was worried about, particularly my nose piercing. I was worried about whether or not people would look at me differently or treat me differently, or I wouldn't get the same positions or whatever. But I've also recognized that if someone thinks that way, that's not where I need to be anyway. And I'm totally fine with moving on and finding a place that serves me as a whole human. Because me being myself and showing up as myself is more important than any title, any paycheck, or anything in those issues, right? And so I think for me, it's important for Black women to stand in who they are, be proud of themselves, be seen for who you are, be recognized for who you are, and not to change yourself to meet anybody else's status quo. I think for me, that's really important. So for me, that's my vision, is for you to be you. And what was the last one?
Period.
Right, period.
Period.
And what was the last one? Was personal
The
vision?
last one is your personal vision.
Oh my gosh, my personal vision is probably the hardest because I don't know. Like, my initial answer is for my children to be successful and to be happy. But that really has nothing to do with me. Right? And so I want the world for my children, but I guess I want the world for me too, and for my husband. And I think personally, my vision is for me and my family to just continue to grow together, because I think, as everyone knows, like, if you're older than 7 years, you probably figured this out, right? We're continuously growing, right? There's always something new. There's something new that has your attention, some new hobby or a new way that you think, or a trauma like grief that comes in and changes a part of you, right? So we're forever adjusting. And I think for me, my family has been amazing in supporting me. They've been amazing in loving on each other. And so I think my personal vision is just that my family and I continue to exist together in a happy and healthy way as we navigate the world for the next however many years. Like, I couldn't ask for anything more than that. I think, like, the personal accolades or positions or whatever, like, all that stuff is great. But what's most important to me is that family unit that I have at home, right? And the support that I have of my extended family. So me finding ways to really strengthen my core, because without my family, goodness, I would be completely lost. And I think that, to me, I think that personally was most important. Is just keeping that strong front at home.
That's beautiful.
No, thank you.
That's really, really beautiful. Oh my gosh. Well, thank you so much. I've really enjoyed this conversation with you. Yeah. And again, I mean, you have a lot of stuff going on, so I appreciate you taking the time to come and talk to me.
Oh, it's been my pleasure. Thank you for inviting me.
Absolutely. Absolutely. So I want to make sure that our listeners know the best way to connect with you, so they can learn more about you, but also about your courage.
Oh, absolutely. So I would say the best way, best ways, one would be LinkedIn. So I'm just Nandi Marshall for LinkedIn. It's easy to find me on there. And then also I have a website, so it's www.nandimarshall.com. So that's another way. And there's even a little email feature that you can send me an email. But those are the best ways to contact me. And I'm happy to connect with folks and hear more about how they're being courageous in their world.
Oh, that's great. I'm going to put the contact information in the show notes, so it'll be easy for people to find. And, I just want to say thank you for sharing your thoughts about the term BIPOC. That really gives me something to think about. And I can totally see how that does center whiteness, and that's not the point.
Yeah,
so I get
that it's not the point, right?
That's not the point.
Yeah, it's just one of those things that has rubbed me wrong since the first time I heard it. And I'm always like, I roll. But I also find it as an opportunity to talk about why I feel that way, right? Because again, unless we have these conversations, then we don't know. So
yeah. Thank you. So I feel like I learned something. I mean, I learned lots of things, but that's an important thing for me to learn and think about. So, okay, well, I look forward to staying in touch with you and continuing to follow all of the amazing work that you're doing.
Oh, thank you. I look forward to keeping in touch as well.
And, include photos of your nails.
I
want to follow that journey as well.
Right. I never post my nail pics on LinkedIn, but I do post them on Facebook sometimes. So you'll have to find me on Facebook.
Okay. Sounds good. Okay. Thank you so much.
You're welcome. Bye.
Bye. Sometimes courage is running for president when fear tells you not to. Sometimes courage is honoring your grief while still choosing joy. Sometimes courage is being the one voice that speaks up because your students, your colleagues, and your community are watching. Dr. Nandi Marshall reminds us that courage means honoring your whole self and speaking up not just for yourself, but for the future of public health. You can connect with Dr. Marshall on LinkedIn to learn more about her and her courage. All the links to connect with her are on our show notes page for this episode, located on our website, courageouspublichealth.com, under episode 17. Before you return to your day, take a minute to sign up for the weekly Courageous Public Health podcast email updates so you never miss an episode. You can do that on our website at courageouspublichealth.com because there's more great stuff to come. Thanks so much for being here. Until our next episode, stay courageous. Thank you for listening to the Courageous Public Health podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.